Hello friends, I am Dr. Tapeshwar, Plastic and Cosmetic Surgeon at Janakpuri, New Delhi. We are working in association with HexaHealth and today we will be discussing hair transplant. Hair transplant is one of the most common plastic surgery procedure being taken on. So we will give you general information as well as specific information regarding the details of the procedure. Previously we had wigs, we had patches and weaving of hair. Why are so many persons shifting from all these artificial things to the hair transplant? The main is the cost has substantially come down. It is almost 30% down from the period it was first introduced. Second is there is no maintenance at all. Third is it is all natural. Your own hair are being transplanted. And the most important is the transplanted hair, they grow like normal hair. No one can make out the hair is transplanted or not. We give you such a good density that the transplanted hair, they looks all normal. So rather than spending every month going in for weaving, going in for wig, transplant is just one time investment. You don't need to come to us. There is no maintenance, no costly medicine. So in a long run, transplanted hairs, transplant procedure is much cheaper than all the artificial things. So I advise everyone not to go for short-term gains, invest one time and go for a transplant that is lifelong. So we have done hair transplant from maybe 20 years to up to for 55 years. Any age of person till he is medically fit to undergo surgery can have hair transplant. Even white hair can be transplanted. So anyone can do, but now the exact indication. It is the receding hairline. Receding hairline means you have a permanent loss of hair. It should not be a diseased area. It should be, we call it androgenic alopecia. This is the right reason. Even some females, we have done transplant in few females also. There also is a different reason, but you need to rule out you don't have any medical history disease like thyroid and receding hairline. This second indication is when you don't have a receding hairline is maintained, but the density is less. So you can put in more hair to increase the density. So there are two main indications. Either your hairline is receding, you need to advance the hairline, or you need to increase the density. Hair transplant, they are live hairs. Live hairs means jinda baal hai. We transplant hairs along with the root. Along with the root means they will grow like normal hair. The hair, it grows from a root. The hairs, they have normal cycle. A part of a small percentage of hair, they keep on falling even in normal person. And from that, the root, it again comes out. New hair comes out. Similarly, in the transplant, we transplant roots along with the follicle. Even if the follicle falls, a new hair will come out through that root. So this is a normal mechanism. We are just transplanting a hair along with the root from your back of your head to the front of your head. The procedure of transplant, it has two common methods, FUE, FUT. The transplant procedure, it started with FUT, where we would take a long strip of skin along with hair. On the bench, we would separate each hair. Then separated hair would be transplanted on the front of your head. I won't say it's a bad technique, but this technique has gone out of favor. People don't want a cut on their scalp. Although the mark is not visible, still they don't want cut. So the FUE technique evolved. In FUE technique, we don't give a cut. With a drill, a punch, we take out every single hair along with the root. It's a motorized drill which goes along the track of the hair, takes out the hair along with the root, and it is stored. And then the same hair is transplanted as such in a stabbed hole made in the front of this. So FUE technique, it is more popular. More than 85% of the cases today we do is FUE because it doesn't involve any cut, and so that is the preferred technique these days. first thing you need to know, is it the surgeon doing a surgery on you? Is he a plastic surgeon or not? Secondly, how frequently he is doing? Is his staff trained or not? Is his clinic properly equipped or not? Is his clinic properly equipped for any emergencies? So these are all things you need to know. It's a very wrong trend has started where even in a one room clinic people are doing hair transplant. This is wrong. So ask for a properly equipped clinic with proper OT, proper lighting. And secondly, then you need to know what procedure will your surgeon will be doing, FUE and FUT. We do both the procedure, but it should be informed to the patient what procedure the surgeon is about to do. And then you need to know how many hairs, how many follicles the surgeon is doing. Then you need to know what is the quality of your hair. The final result depends upon the quality of hair. Maybe in thin hair, the result may be not so good as compared to the person having thick hair. So these are the reasons for you to know so that you can anticipate the realistic result. This is permanent. Whatever hairs we implant, out of that 85 to 90% is the success rate. Means 85 to 90% hairs do stick up and they will grow like normal hair. They don't need any maintenance. Only when you want more density can this another procedure in form of another transplant be planned. Otherwise they are permanent, they grow like normal hair and they will grow lifelong for you. They will grow as good as your normal hair, non-transplanted hair. The results from a transplant, they are not immediate. It is unlike the wig. The result, they will come out in 4 to 6 months. Let me explain why. When we transplant, we take out just few millimeter of hair along with root. And during the 15-20 days, 1 month, 20 to 30 up to 40% of the shaft falls. Hair will fall, but the root will stick. So from that root, a new hair will come out. This all circles take 4 to 6 months. So for good results to be seen, at least you need to wait for 4 to 6 months. Patients usually come and ask, how long will it take? Usually we tell them, you will be here with us for full day. The exact number of hours depend upon how many hairs have to be transplanted. We usually transplant from 2500 to maybe 5000, 6000. 2500 will take around about 4 to 5 hours and 5000 to 6000 will take 8 to 10 hours. So it's a long procedure. Each hair has to be taken out separately and to be transplanted separately, so that it takes time almost half to full day. Hair transplant is a natural shifting of hair from your own hair from back of your head or from other body part to the front of your head. So since there is no artificial thing is involved, so it doesn't have any side effects. The minor side effects can be a little infection and pain or maybe some sensation over the head. My patients usually complain of some numbness for 3 to 4 days and some sensation is in the scalp, in the head for 15 to 20 days. But that is not that much to limit your activity. You can perform your normal activities from next day onwards. Even if you are comfortable attending your office with a big bandage on your head, even that is allowed. Otherwise, there is no downtime, there is no complication. Whatever minor complications are there, they are all manageable with simple painkillers, and whatever complication is there, downtime is there, it is just for 10 to 15 days. After the surgery is completed, you will have a full hair bandage, full head bandage that will be there for 4 days. After 4 days, we'll give you the first head wash. That is usually given by us. After that, there is no maintenance. After 4 days of surgery, there is no maintenance. You can take normal bath. You can use normal shampoo. The only thing will be that you need to come visit us every maybe week 10 days. Otherwise, even regular visits are not required. If you are outstation, the visits can be managed on video call also. So the good thing about hair transplant is there is no hard and fast any management for which there is no any drug. We can just give minoxidil lotion for local application just to increase the growth. Otherwise, there is no maintenance as such in hair transplant.